Thank you, Jill. Our next speaker is Carolyn Wafford. She is a proud Army wife. Proud Army wife. And a mother of 3 daughters, Lindsay, Grace, and Hannah Rose. Just put Hannah Rose right here for you. She grew up in North Carolina, but Texas is now home. It is where they are currently stationed. Her husband is a sergeant major and works at the Joint Base Army and Air Force Hospital in San Antonio, Texas. They met at the University of North Carolina and have been married 24 years. Carolyn holds degrees in gerontology and religious education. She has chosen a career as a wife and mom because that is what I do best. She's doing this, I'm sorry, so reading her words, she said that is what I do best, in spite of her eating disorder and multiple moves to 5 states and Europe with 11 different addresses. She loves America. Thank you.
I titled this The Battle to Save Lives, Eating Disorder Gaps in Military Insurance. It was $910 a day. That was the figure we were provided for our daughter Hannah to receive treatment for her eating disorder in the outpatient setting where we live. Keep in mind, we don't have a choice where we live. We go where you tell us to go, proudly. We had just finished 4 months of 24-hour-a-day inpatient treatment, and this was the step-down treatment program that was adequate for her needs. As an active duty military family, I just knew TRICARE would cover it. After all, it wasn't an optional treatment. It was life or death, and I knew I didn't need to worry. We are part of the greatest military force in the world, and this was not a condition that resulted because she wanted to be skinny. My new friend in our eating disorder support group described it this way: an eating disorder, she didn't choose it, and I didn't cause it. I also learned that eating disorders do not go away after inpatient treatment. The average recovery period, the average is 2 to 7 years, and there's various levels of treatment that many patients need to go through before they're recovered. Hannah was so young, only 14 years old, and had an early diagnosis. I thought we were going to be okay. She was diagnosed when we were stationed in Germany. Her heart rate became so low due to her starving body eating the fat around her heart, and due to her weight loss, that they put us on a medevac plane leaving Landstuhl Medical Hospital, and we flew to Walter Reed. I had no idea that I wouldn't see my husband again for almost a year. Research has determined that eating disorders are most successfully treated in a multidisciplinary setting, which meant we would need a team of an individual therapist, family therapist, medical doctor, psychiatrist, and dietary team. She needed group counseling and classes. We found that multidisciplinary treatment setting, but we also found that TRICARE military insurance didn't cover her treatment. TRICARE states that freestanding facilities for eating disorders or any other psychiatric care are not covered. They are not covered. No exceptions. The only facility that has a focused multidisciplinary treatment plan in South Texas, where we're stationed, is freestanding. Let me say that again. San Antonio, Texas, Military City, USA, does not have insurance coverage for outpatient eating disorder treatment. Without insurance coverage, we had to pay most of all Hannah's treatment. My husband makes a base pay of $64,000 a year as an enlisted soldier. That's a lot of money. He has 19 years of service, and we are so proud of him, and so is his country. Because of our long history serving our country, I honestly thought I'd be able to just educate those in Congress who could do something about a regulation written all the way back in 1983. That was what established that TRICARE would not cover freestanding facilities. I thought if they just understood that freestanding facilities are one of the generally accepted standards of treatment for patients with eating disorders, you would change the regulation. And there would be medical treatment for every military member and family member that suffers the most lethal of psychiatric illnesses, eating disorders. I became very busy researching, thank you Internet, the federal regulation that resulted in TRICARE's inability to cover Hannah's treatment. I wrote to our senators, our congressmen, I called every federal and state agency, anybody that could offer assistance. I spoke to 21 agencies in all, and I discovered there was a chance if I worked fast enough to send an urgent plea just in time for consideration of the Defense Appropriations Bill in 2013. However, after relentless emails, phone calls, and unanswered messages, my contact here said we missed the boat. The bill was passed without any discussion of changing the CFR that impacted the way TRICARE does or doesn't cover benefits for eating disorders. I want you to know Senator Cornyn and Congressman Lamar Smith's office responded to me, and Senator Burr. I have letters and I thank them. But unfortunately, the federal regulation governing TRICARE remains unchanged and still reads as it did back in 1983. A freestanding eating disorder program is not eligible for status as an authorized institutional provider of services and supplies. I have the reference if you need it. In the meantime, we asked the outpatient facility to provide her the best care they could for $510 a day. That's the half-day program rate. And so we started paying. We used all our savings and borrowed $5,000 from our daughter, money that was supposed to pay for her second year of college. The treatment facility suggested that we take a mortgage on our house and use our college savings. That day, I walked out of the treatment facility for the first time in my life, feeling like a failure as a military parent. See, we don't own a home. We moved 9 times in 19 years. We don't have college savings because I have bright girl and we get scholarships. I have a degree and there's some jobs in that field, but not often at every assignment. So I started working as much as possible as a substitute teacher to earn money on the days that Hannah wasn't in treatment. The cost of pain, $510 a day, weighed heavily on our family every day. Not a good part. Ultimately, Hannah made progress in treatment, and it's been a year now. She has healthy coping skills. She's healthier physically and mentally. She found a new normal way of life. While her body healed physically, her mind became stronger, and she now has a glimpse of what life without an eating disorder might look like. We just celebrated homecoming last weekend. As with most mental illnesses, it's hard to keep the shame-filled illness a secret. Hannah's now a 16-year-old high school junior with hopes and dreams. But sadly, I made the grievous mistake of telling her about the financial burden of this care. I can picture her like Atlas. She has a slight frame with the weight of all of our financial futures and her own health pressing down on her shoulders. It's not about the money, and it's about the money. She can't continue in treatment unless we find some more money, and there's no golden pot at the end of this rainbow. She shouldn't have to carry this burden, especially not while she's trying to recover and trying to get back to living a normal, healthy, and productive life. To get here, it took a leap of faith and courage. I started reading the blogs of the people that were in attendance today, preparing for this very moment. You have daughters that died, and I am so afraid I'm going to be back in front of you in 3 years. again. But see, that's when our Hannah goes off to college. I have fallen on my knees so many times and prayed that that wouldn't be her future. Because when they go to college, what happens is the disease can come back with a fury. It ravages their mind and their body, and they're alone, and they die. The voice of Ed will scream in her mind, and there'll be no one there to help her. My biggest fear with my other two daughters in college was experimentation with alcohol, and at worst, sexual assault. I pray Hannah eats. But I know if my girls are alive, we can recover from anything. We're Army strong. I just worry she needs treatment again, that we won't be able to pay for it. Military members, okay, this is supposed to be the punchline. Hold on. Okay. Military members are often called heroes, and rightly so. But today, you and your bosses can be our heroes. You are right now because you're listening to our stories, my daughter's story. And your boss can be a champion and stand up to help us pass legislation that will address eating disorders, including updating one outdated word in a federal regulation. Thank you.